Did you know that in the 19th century, doctors performed amputations without any form of anesthesia? Imagine the sheer agony patients had to endure. It's a chilling thought, isn't it? But that was the shocking reality of historical surgeries. In the days of yore, medical knowledge was limited, and surgical procedures were often brutal and horrifying. From trepanning, where holes were drilled into the skull to cure ailments, to bloodletting with leeches in hopes of balancing bodily fluids. The list of hair-raising practices is extensive. And it's not just the procedures themselves that were terrifying. The lack of hygiene often led to deadly infections post-surgery. But fear not, these dark days have passed. Over the centuries, the field of surgery has evolved dramatically. So brace yourselves, history buffs. We're about to embark on a fascinating, albeit slightly terrifying journey through time. Join us as we delve into the evolution of surgery, from its brutal beginnings to the sophisticated procedures we know today. Let's take a step back in time, way back to the Stone Age, where the first surgical procedure, trepanation, was performed. Imagine a world where the complexities of the human body were as mysterious as the stars above. This was the reality of our ancestors in the Stone Age. Their solution to ailments, as crude as it may sound to our modern ears, was trepanation. This practice involved drilling or scraping a hole into the human skull to treat health problems related to intracranial diseases or to release trapped spirits believed to be the cause of mental illnesses. As terrifying as it sounds, trepanation was just the beginning. As we moved into the age of ancient civilizations, the Egyptians, Greeks, and Romans took the surgical baton and ran with it. They introduced the practice of bloodletting. This was the process of draining bad blood from the body to cure or prevent illness. The rationale was simple, yet fundamentally flawed. They believed that the body was made up of four humors: blood, phlegm, black bile, and yellow bile. Any imbalance in these humors was thought to cause disease, so if you were sick, it was because you had too much blood. The solution? Drain it out. And then there were the leeches. These slimy creatures were the go-to medical tool for centuries. Their job was to latch onto the skin and suck out the bad blood. As revolting as it sounds, it was a widely accepted practice, used to treat everything from headaches to gout. These early surgical practices, though primitive, were born out of a desperate need to understand and heal the human body. However, they carried massive risks. Without a proper understanding of infection, hygiene, or even the basic structure of the human body, these procedures often led to more harm than good. As time went on, surgical procedures began to evolve, but not always for the better. Fast forward to the Middle Ages, a time of superstition and fear, where surgeries were often more dangerous than the diseases they were meant to cure. In this era, surgical procedures were steeped in a chilling mix of ignorance, desperation, and audacity. Without the knowledge of bacteria or the concept of sterilization, surgical practices were riddled with risks, often leading to infection and death. One such practice was the use of boiling oil for wound treatment. This was not your typical spa day hot oil treatment. No, this was a brutal and painful process, thought to cleanse and cauterize wounds. Surgeons would pour boiling oil into open wounds, a procedure that often resulted in severe burns, increased infection, and unimaginable pain for the patient. The Middle Ages also saw the removal of organs as a common practice. Without a clear understanding of the human body and the functions of different organs, surgeons would often remove what they deemed as diseased or unnecessary organs. This could range from the removal of a diseased lung to a troublesome spleen. It was a hit-or-miss approach, with the patient's survival often hanging in the balance. And then there were the surgical theaters. Far from the sterile, well-lit rooms we know today, these were places of horror and despair. Surgeries were performed without anesthesia, with audiences watching as patients writhed in pain. The floors were often covered in blood and discarded body parts, creating a breeding ground for disease. The surgeons, dressed in their blood-stained aprons, were more akin to butchers than the skilled practitioners we know today. These dark practices were a stark reflection of the times, a period when superstition often trumped science, and survival was a matter of luck rather than skilled intervention. Thankfully, the dawn of the Renaissance brought about significant changes in the world of surgery. The light of knowledge began to penetrate the shadows, leading to more humane and effective surgical practices. But that's a tale for the next scene. The Renaissance, a time of enlightenment and discovery, also brought about a revolution in surgery. This was a period of transition where the practice of surgery began to shift from being a craft, often associated with barbers and butchers, to a respected profession rooted in scientific understanding. During the Renaissance, the study of human anatomy began to take center stage. Physicians like Andreas Vesalius broke away from the ancient Greek teachings of Galen, daring to dissect human bodies and making astonishingly accurate sketches of the human anatomy. This newfound knowledge allowed surgeons to understand the inner workings of the body, leading to more precise and effective surgical procedures. Alongside advancements in anatomical understanding, the Renaissance era also saw the introduction of specialized surgical tools. These tools, many of which are still recognizable in modern operating rooms, provided surgeons with the means to perform more complex operations. Scalpels became sharper, forceps more precise, and the amputation saw, though grim, became a staple in the surgical toolkit. However, it wasn't all progress and enlightenment. Despite these advances, the fight against infection was still in its infancy, and the concept of germs was yet to be understood. Surgeons operated in unsanitary conditions, often leading to post-operative infections that proved fatal. Moreover, the concept of anesthesia was still centuries away. Procedures, including amputations, were performed without any form of pain relief, making the surgical experience a torturous ordeal. Yet, it is important to remember that these were the stepping stones that led to the surgical practices we have today. The Renaissance revolution in surgery was marked by both groundbreaking discoveries and painful limitations. Each advancement, each setback was a part of the journey that has shaped the field of surgery into the life-saving discipline it is today. As we moved into the modern era, surgery continued to evolve with both triumphs and tragedies. Entering the 19th and 20th centuries, the world of surgery saw significant advancements, but not without its share of horrifying practices. This era, often hailed as the dawn of modern surgery, was marked by a clash of groundbreaking innovations and shocking procedures that would make anyone shudder. In the early 19th century, the introduction of anesthesia revolutionized surgery. Imagine the sigh of relief as the first patient drifted into an oblivious sleep, free from the torturous pain of the surgeon's scalpel. Ether, chloroform, and nitrous oxide, these were the holy trinity of pain relief, transforming surgical procedures from brutal episodes of endurance into manageable, though still daunting experiences. Yet, as the century wore on, the surgical world was not content to rest on its laurels. Enter antisepsis and sterilization, championed by the likes of Joseph Lister. No longer would surgeries be performed in filthy, infection-ridden environments. Surgeons began to understand and respect that invisible killers, known as bacteria, lurked in every corner. Sterilization of instruments and a clean surgical environment became the norm, dramatically reducing post-operative infections and death rates. But even as these advancements were saving lives, other practices of the time were far less humane. The 20th century saw the rise and fall of the lobotomy, a procedure that involved severing connections in the brain to treat mental illness. It was a crude and often disastrous solution, leaving many patients with severe cognitive and emotional impairments. Similarly, electroconvulsive therapy, while still used today in a vastly more controlled and humane manner, was initially a brutal practice. High doses of electricity were passed through the patient's brain, often without anesthesia, leading to violent convulsions and memory loss. Today, we can thankfully look back on these practices as relics of the past, thanks to the continuous advancements in medical science. The journey of surgical history is a testament to human resilience, curiosity, and the unending quest for a better understanding of our bodies and minds. Surgery has come a long way from its crude and often brutal beginnings. From the primitive era, where crude tools and a lack of knowledge often led to dire outcomes, we've journeyed through the Dark Ages, where superstition often overruled science. Then we witnessed the Renaissance Revolution, a period of enlightenment, where the seeds of modern surgical practices were sown. In the modern era, we've seen an abandonment of brutal practices, replaced by precision, understanding, and a deep respect for human life. We've moved from a survival-based approach to one that prioritizes the quality of life and long-term health outcomes. Each step of this journey, every abandoned procedure, has been a stepping stone to where we are today. The evolution of surgery is a testament to human perseverance and our unending quest for knowledge. As we look to the future, we can only imagine what new advancements await us in the ever-evolving field of surgery.